Good afternoon, everyone. Happy Easter Sunday to all of you celebrating. It looks like we're live, and of course, during this time, if you're tuning into this with us, please share this with your friends, with your family, because today's topic is a very important one. We're trying to make mental health more mainstream, and I believe that this should be done right now in this pandemic era, especially. So, if you're tuning in to Talking Life with Macy, and you think that there are friends or family who actually have uh, any symptoms related to depression, I think this would be a good time for you to share it with them. So, for those of you who are wondering how do you share it with them, what you can do is if you take a look at your phone, there's a share button on the post itself. Click share, and you can share it directly on WhatsApp, for example, to your friends or your family, or you can even share it on Facebook itself, on Twitter, on Instagram. So please get them to tune in, especially for those who you feel have any anxiety issues, depression, bipolar, any of these things, because we want them to understand and get to know more about what depression or mental health is. I know that everything is opened up. A lot of people are heading out or are already out, but we want them to come in to understand more about mental health problems that are plaguing our society. I know that some of you actually, I saw comments that some of you think that depression is not a disease and it shouldn't be taken, like seriously, but that's not true. And we should actually educate people to know more about depression, what it is. So I know that there are a few of you who ask me, like, how do I get on the page? So for you can share it with others. Actually, this right now you can just click the share button as I've mentioned, and for those of you, you can just go on my Facebook page www.facebook.com/truemacy and click refresh, and you'll be able to see it. So I think that we will wait for maybe 1 more minute before we begin, or maybe 30 more seconds before I actually start introducing people. And I hope that people will start coming in further after this. So, today's topic is understanding depression in this pandemic era. And I think this also commemorates the second year anniversary of Talking Life with Macy. We are going to officially begin today's show. So, good afternoon to everyone. Happy Easter Sunday to all of you celebrating. I hope all of you had a good brunch, lunch, and you're tuning in because this is beneficial for you, your friends, and your family. I think that mental health is becoming more mainstream, which is a good thing. But there are also a lot of people in Asia that still does not, that they don't believe in depression. They don't believe in schizophrenia, for example, anything related to mental health. And that's why we're having today's show on Talking Life with Macy. I know that ultimately some of you are going to save this and watch it later on, but we want you to come on now because we have an expert on the show who can answer the questions that you may have. So today's topic, as I mentioned, is understanding depression in this pandemic era. We started off Talking Life with Macy with me, one person staring at a camera talking about mental health issues, because that was the beginning of the pandemic. Now it has been 2 years, and we're going to commemorate 2 years by talking about mental health, depression particularly. And we're also going to talk about this in conjunction with World Health Day 2022 that has just passed. So let me share with you a little bit more about depression. Um, it is it affects 3.8% of the population according to WHO, including 5% amongst adults and 5.7 amongst older adults. Depression, which is a major depressive disorder, is common and a serious medical condition that negatively affects how we feel, the way we think, and how we act. It was on the rise, especially during the pandemic. So today we have a psychiatrist. His name is Dr. Ting Hang. He practices in Sunway Medical Center at SGMC, and he has his own clinic. So, Dr. Ting,
Hi,
hi,
good
welcome to the
afternoon.
show.
Thanks, Missy.
Good
Thanks for inviting
afternoon.
me. Yeah.
Thanks for joining us. I believe people will slowly filter in on
Okay.
and off. So we're going to just start the session so that I don't keep you waiting for too long.
Okay,
And for
no
those of
worries.
you
Yeah.
who have questions, I think it would be great if you can actually just put them in so that Dr. Ting can actually answer them towards the end of our Q&A session. So,
Sure.
Dr. Ting, since the
Yes.
pandemic, we have seen a rise in mental health issues, including depression.
Right.
Is that the case for you as well as a psychiatrist?
Yes, I think absolutely. I think the other day a colleague of mine was joking with me. He was saying that to refer a case to me takes about the waiting list is about what 2 weeks to I mean a duration specific duration. And I was telling the colleague that it's not because I'm popular. It's just because there has been a sudden surge of cases of depression, anxiety, insomnia, the three most common conditions during this pandemic. And I think most psychiatrists now have a longer waiting list. So we are trying to accommodate as many people as possible, but understandably there's been a surge, right? So I think we in the private sector we've been more busy. In the government sector, then understandably they've been even busier. I'm sure the waiting list is much longer than that. But we only have 400 plus psychiatrists in Malaysia, so I think we are trying to cope with the sudden surge. Yeah.
I see. So, Dr. Ting do people call you Dr. Ting or Dr. Joe?
In the hospital, they call me Dr. Ting. Friends call me Joe. It's easier to, yeah. So
Oh,
either one
okay.
is,
So I'll
either one is
just
fine. You can call me Joe,
I'll
it's
just
fine.
call you
Yeah.
Dr. Ting.
Okay.
So, Dr. Ting, how is depression diagnosed? I think this is very important for everyone to know.
Yeah. Okay. Good question. So if you look online or internet, they'll tell you there are 9 symptoms, right? The 2 core symptoms would be a pervasive depressed mood or a loss of joy, or what we call anhedonia. There's no joy anymore, right? So, and then there are other symptoms like your sleep disturbance, your energy level, focus, concentration, death wish, etc., etc. So you can look up the 9 symptoms. I think the key point. So there are 9 symptoms, out of which 5 must be fulfilled for a period of 2 weeks. So there's quite a lot of things to go into. So I don't really want to go into those kind of things. I think the key point here is when I give thoughts to lay people, I just want them to realize, when do you think you need to see a psychiatrist, right? Or a mental health professional, a psychologist or a psychiatrist. So all of us do feel depressed on and off, right? Sometimes for a few days we just feel a bit down. Maybe a loved one passed away. Maybe like we are going through some work stress and all.
Yeah.
So how do we differentiate normal depressed mood and clinical depression? So I think one of the key things is, a lot of times, let's say when we go through certain stressful period, we will have a lot of the symptoms. For example, we feel depressed most of the time. We don't feel like we enjoy things as much as usual. We will feel like we can't focus, we can't concentrate, sleep disturbance and all. Now, the thing is, in depression, right, in clinical depression, a lot of times the duration will be much longer and it persists for most of the day, right? So every day you're just feeling down. You can't perk yourself up. Even someone does something nice for you, you can't perk yourself up. And this goes on for weeks. And then the key thing here is, when do you see a doctor is when your interpersonal life starts to deteriorate. That means like, your relationship with other people. When your work starts to deteriorate. That means like when you're present at work, we call it presenteeism. Physically you're present, but mentally you're unable to focus, you're unable to concentrate, you're more irritable, you find that most things are very overwhelming. And this persists for some time, then it causes a dysfunction in your daily activities. Then I think it's usually a clue for you to maybe talk to someone, or call out a helpline and then just ask for an opinion as to whether you need to see someone. So clinical depression is persistent, sometimes without an external stress, right? So just for no apparent reason. For example, let's say COVID-19 started, I think the first MCO started 18th of March 2020. So initially, we were all, the honeymoon period, we were quite excited about it, but subsequently then we become more and more despondent. So if that persists, even though MCO has been lifted and all, and then you still feel like you can't focus and all, then it's maybe time to talk to someone about it.
So you would say that if it affects one's work and studies,
Functioning,
it,
yes.
yeah, the way they function, then they could possibly have depression.
Yes, and it's persistent. So when we classify, like just now, as you mentioned, we classify as a major depressive disorder or generalized anxiety disorder, or panic disorder. So when we use this term disorder, that means there's a dysfunction, right? As opposed to the usual kind of depressed mood that we feel sometimes, and stuff like that. Yeah.
So I think during the pandemic, a lot of people were actually complaining that they could possibly be depressed and they actually have depression. So,
Yes,
due to the constant lockdowns, it has exacerbated depression. Why is
yes.
that so?
I guess as human beings, right, even if you're an introverted person, right, so when you're an introvert, you choose to be introverted on your terms and conditions. But basic need for human contact sometimes is still there. You know, some of the introverted people still like to go to the cafe, for example, sit down at the cafe with the computer and the headphone and listen to a song and, you know, like maybe order a cup of coffee and stuff like that. So I think basically we are all still sociable creatures,
Beings.
yeah, social
Yeah.
beings. So we still need that contact. And the introverted people are introverted on their terms and conditions. MCO was unfortunately forced upon us because of COVID, right? All of us have been isolated. So if you look at the data that was published by the Lancet, you can find it at WHO website as well. Depression and anxiety increased in countries whereby there was a daily rate. This was, I think, last year. There was a daily increase in the rates of COVID-19 infections. So we were all anxious, like when are the cases coming down? Am I going to get infected? The death rate was going out, ICU bed was full. So that kind of like provoked a lot of anxiety symptoms in us. And then on top of that, the social isolation, so decreased mobility. So you find that a lot of depressive cases, anxiety cases, insomnia, increase in fivefold to sevenfold in countries whereby there's a lot of daily increased cases and also decreased mobility. So understandably, I think, it was highly, highly stressful. These 2 years has been terribly stressful for all of us. Some of us cope better than the others. And that also depends on the external circumstances. Like some of the B40s then will obviously struggle with other challenges like
Yeah.
finances and daily foods and stuff like that. Yeah. So it's
So,
challenging.
would you say that, Dr. Ting, are people presenting with depression in this pandemic any different from pre-pandemic depressive patients?
I think the the older classification of depression in the earlier days in the 80s, it was slightly easier. So we call it reactive depression and endogenous depression. A reactive depression means that the external circumstances extenuated the depression, right? It triggered the depression.
Yeah.
So, and then the endogenous is like, for no apparent reason, everything's going well for you financially, relationship, health-wise, everything's going well for you, but you're just depressed. So back in the earlier days, it was easier to define. Nowadays, there are a lot of specifiers. Yeah, so it's a bit more complicated. It's like after childbirth or seasonal or like anxious distress. So I think in these 2 years, personally, and I'm sure for a lot of my colleagues, we see the patients with depression. They come with a lot of what we call the comorbid, that means coexisting anxiety symptoms. Anxious about what? Anxious about everything, right? So they tend to be comorbid, so they tend to come under the anxious distress specifier in the depression category. And one of the things that we find very common is also generalized anxiety. So we call it generalized
Yeah.
anxiety is because you worry about everything and you
Everything.
worry about nothing, right? So it's just generalized. So this time we see a lot of people with depression and anxiety symptoms. Anxiety about like just going out of the house, for example, then contaminated by the COVID-19, which is the SARS-CoV-2 virus, which is floating around in the air. Like initially we were all
Yeah,
kind of
yeah.
about that, yeah. And
So my
media,
mom,
yeah, correct. Yes, your
she
mom.
thinks that I'm anxious about COVID, but that's not the case. I just so I think when we talk about anxiety, generalized anxiety disorder, or being extremely anxious about, let's say, going out, maybe Dr. Ting, you can clearly define what it means. Like, how is it different from just normal anxiety? Like, what is this generalized anxiety disorder, or rather this anxiety that really is so pervasive that it affects them?
Yeah. So I think so generalized anxiety. So this will be branching into like another 2-3 talks now. But let me just make it very concise. So generalized anxiety will be just more of like general fear, right? You worry about everything, but worry about going out and all. Now the problem is sometimes it's not generalized anxiety. Sometimes it's just phobia, right? For some people, they're just worried about going out, and then earlier on, we didn't know too much about the virus, right? Even for doctors, we are still learning about the virus 2 years ago. For the lay people, I can't imagine how terrifying it is for you guys. the health ministry comes out and said, it is like, we're deciding whether it's airborne or was it, other forms of mode of transmission. So of course it's terrifying. So some people exhibit phobia, right? So they're just phobic of like touching things or going out or breathing the air outside, right? So, and phobia and anxiety is always based on irrational fears. So subsequently, when the Ministry of Health, the DG or the Minister of Health, starts to reassure people, look, it is okay, it is safer right now, it's okay to go out and all. Now, if the anxiety persists, despite all the reassurances and all, and you completely disrupt your daily life and you do not go out at all to do your daily activities, and up to now you're still hiding in this cubbyhole of yours, like the cave syndrome. So you're just hiding in your cave, then that would be unnatural. So then you have to consider, like, am I going through a lot of anxiety symptoms where my fears are unrealistic? Yeah.
Okay, so
some fear is good because it made us more cautious rather than during the peak of COVID, people go out without mask and sneezing here, sneezing there. So that's also a bit too much, right? Yeah.
Yeah. So for those of you who are tuning in, I think this is a good thing for you guys to understand, for those of you who are still afraid to go out, and for those of you who are also excessively going out. So there's a difference. And Dr. Ting has actually also kind of like highlighted it and mentioned it for all of you to understand more. So the next question then is, how is depression treated? As a psychiatrist, I know that you can prescribe medication. So maybe you can just give me an overview of how it's usually treated.
So I think now, one thing that I want to make very clear is that depression is a medical disease, right? So depression is not what you and I go through sometimes when we're a bit depressed about certain things and recover within 3 days, not after my favorite char kway teow or favorite flat white coffee and everything like that. So depression is pervasive and it is a medical issue. There's usually a genetic predisposition. That means you're born with certain vulnerabilities. It's just like if both parents have diabetes, then likely you'll get diabetes. Some people who are diabetic, but they are very thin, they exercise every day, they're very careful about the food, but they still have diabetes, right? That's because of some changes in the body. So depression is the same thing. So even though you think that you're a very positive person, you can just go out, just go for a holiday and come back and everything, and you're fine. That's not depression. Now, when the clinical depression hits you, you will be sort of like paralyzed with like invalidity. You're unable to do anything at all. You're just so what happens is that the chemical imbalance in the brain. There's one particular chemical to explain depression very, very simply. If certain neurotransmitters in the brain, that is very, very necessary to regulate emotions, right? So when that is disrupted, the person's ability to process normal emotions is completely disrupted. So the person's functioning then starts to deteriorate. The focus, concentration starts to go off. Sleep pattern starts to go off. The body temperature starts to go off. They feel cold and hot and all those kind of things, right? So a lot of anxious patients or depressed patients will feel that way. Then they'll start to like become dysfunctional. And then the negative thoughts will persist, and they ruminate a lot over and over and over again.
Ruminating,
Family members will tell them, look, this is not such a big deal. You're okay. Your life is quite good at the moment, but the person is just stuck in the loop, right? So this is a medical problem that you can't just snap out of it. You can't just come out of it. You just can't go exercise, because when I will go into like what helps, but you can't just exercise or take some supplements or whatever it is to make it go away, right? So just like diabetes, you can't just do that. Unless it's a very mild diabetes, you can just take some supplements, exercise regularly, control your food, and you're okay. Depression is the same thing. If your depression is mild, you can just exercise, pray more, and like hang out with friends more. Then it will help a little bit, but you still need other forms of help. So first of all, we have to understand that depression is not just a normal depressed mood that I can just snap up off by going for a holiday, right? So depression, you don't even feel like going out. Even to get up in the morning to brush your teeth is so difficult for the person to be able to just do like just go out. Taobao food is so difficult for the person because there's no energy, and to make decisions as to what do I want for lunch, do I want fan, or do I want wanton mee, that everything becomes daunting for the person, right? So we take it for granted. Just like when you are well, you take everything for granted, but if you're having fever, to go to the kitchen to make yourself a glass of like honey and everything like that, it's troubling because your body aches, you feel very unwell. Okay, so let's say you've been diagnosed to have depression. It depends on the severity. So we talk about mild depression first. Mild depression, then sometimes you can do without medication. So you can just, the best thing would be see a therapist. So it's just counseling. So no medications, it's just counseling. So the things that you can do for yourself is that you can just like maybe meditate more, pray more, depending on what religion you are, exercise a little bit. And then usually depression for depressed patients in the morning is worse for you. So I usually tell my patients, don't try to exercise in the morning because you're so overwhelmed by the depressed mood. That's because of some changes in the brain. That's why it's always worse in the morning. So I tell my patients, try in the evening, like just do 15 minutes walk. We just want to spark something in the brain so that you'll be, be able to recharge yourself. And then try to do things that is pleasurable for you. For example, you like to go to a particular shop to eat certain food, but don't go when it's crowded. You go early, just go there, eat it, and then come back. Do things that you used to like. So sort of like to provoke a muscle memory, to provoke a memory that you like, you used to love. So anything that can help you. So therapy sessions will be just not talking. Now you must understand when you are referred to a psychologist or therapist, it's not just about talking, right? Talking, anybody can talk. So it's not just about listening and allowing to ventilate. What they will try to do is they will try to identify the automatic negative thoughts that's always in our mind, like, oh, I'm worthless, I'm a burden to my family, like when the person's depressed, they feel all that. I'm worthless, I'm a bad person, imposter syndrome and all those things. So what the psychologists will try to do is they'll try to identify all these negative thoughts and then try to sort of help you realign to something more positive. So it takes a lot of effort and work, but it will help in the long run, right? So then they will encourage you to do whatever you can do to make yourself feel better, exercise a bit, nothing too much, because if it's too much, then you can't do it, then you feel like you're a failure, right? So all these things.
So cognitive behavioral therapies.
Yes, so cognitive behavioral therapy is one of the things that's quite useful for therapy. So a lot of times people will tell you, oh, I've got good friends. I don't think I need to see a therapist. I've got good friends. They listen to me. They support me and everything. So those are just supportive treatment. It's a bit different from what we do, which is CBT, something more precise, something more, So you have to go into the thoughts and then try to modify them. And then when you try to modify them and it's not successful, then you have to try other ways, so you have to keep looking for ways to go about it. So that's for mild to moderate depression. That will be helpful. Get people around you to sort of remind you about things are okay with you. Usually for depressed patients, I usually don't tell them, hey, look at other people. Some people got more serious disease, they have got financial problems, their husband left them, so you're so much better off. It doesn't matter, right? Let's say if I have dengue and burning out at 42 degrees fever, it doesn't matter whether the other person is rich or the other person is poor, right? I'm just suffering right now, so help me, right? So I never find that kind of advice useful, but a lot of people tend to use that kind of things, like your life is so much better than the other person. The other person is like, like the husband left her, look at her, all these kind of things. So that's mild to moderate. So it can still be taken without medication, but medication will actually be helpful. So medication will be for moderate to severe patients. Now, why is medication important? So I want to emphasize on this. A lot of people think that, okay, psychiatrists always are keen to prescribe medication. That's not, I feel that's not true. We will prescribe provided there's an indication for it. For example, the person is unable to function. So when the person is unable to function, I will give an MC for about 1 month to 2 months, depending on the case, of course, where the company allows, because they are unable to focus and concentrate. So why they can't focus and concentrate, why they can't regulate their emotions is because of the neurochemicals in the brain that goes a little bit haywire. So there's a deficiency. So what we are trying to do is give medications that's not going to cause addiction or not going to cause a person to become habit forming. It is not addictive. I mean, those are just tranquilizers that we use temporarily, but the antidepressants per se, they are not addictive. And they will help. And these are not happy pills. A lot of people say it's happy pills. I really don't like the term. What it does is it regulates emotions to the point whereby then you're able to regulate normal emotions. Because if it's a happy pill, then I think I want it as well. It doesn't work that way, right? So if our emotions are regulated, then antidepressants will not really work. But when the person is dysregulated, just like diabetes, so when the person's neurochemicals are imbalanced, the medicine will help to regulate it. Then the person will start to feel more normalized. then the counseling and the positive activity, all those things will be very, very helpful.
I see. All right. Thanks, Dr. Ting, for giving us the options for treating patients with depression. So, the next question then, also for those of you who are tuning in, you may put in your questions now. I have two more questions for Dr. Ting, and then I believe he can actually answer the questions that you guys have to understand more about depression. So, my next question is: are there many subtypes of depression or just one?
So we are classifying as sub-specifiers in a way they're subtypes. So for example, peripartum, that means about before and after childbirth. Then
Right.
overseas, you see seasonal affective the depression that happens more during the winter, right?
Winter.
Malaysia,
Yeah.
I've seen one case, but that's because she came back from UK, right? And it's quite bad. So you have to do light therapy, Then we have the anxious distress, whereby a lot of anxiety symptoms, and a few others. So some will be the mixed phase. But the general thing is there are some sub-specifiers, but usually when they come to see us, we will treat it regardless of whatever sub-specifiers is usually useful for us when we are doing therapy. Sometimes when you're doing you want to know about the subtypes. Yeah.
I see. So, Dr. Ting, in your opinion, the most common ones that you've seen in Malaysia would be generalized anxiety disorders and major depressive episodes.
It largely depends, actually. Like when I was working in the University Hospital, UMMC, then in the government setting, we tend to see a lot of schizophrenia, patients with
Yeah.
schizophrenia and bipolar disorder, right?
Okay.
I think partly that the severity of the conditions. In private sector, then we see mainly the more neurotic diseases like major depressive disorder and the umbrella of anxiety disorders, meaning you talk about generalized anxiety, panic disorder, phobias,
Right.
post-traumatic
Panic
stress,
attacks.
obsessive compulsive disorder, so on and so forth. Yeah. So in the private sector, we see more of that, less of the schizophrenia and the bipolar. Partly because I think the cost for schizophrenia and bipolar is higher. So
Yeah.
yeah.
Okay, that's interesting to note. Once again, for those of you who are tuning in, you're tuning in for a reason. So please put in your questions for Dr. Ting. He's here today on Easter Sunday. So please ask him any questions you may have. You want to know more about the diseases and about depression. So my last question for you, Dr. Ting, is there any word of advice for those suffering from depression or think they have it?
Right. So, like I said earlier, so if you feel like there's a lot of dysfunction in your daily lives, then ideally see someone. But I think generally speaking, the advice that if you've gone to social media or you've gone to look at online, so during the first lockdown, right, during the early lockdowns, there was a lot of information about how we can, what we can do to sort of like get ourselves out of the funk, right, that we were in during the lockdown So I think generally we will advise those kind of activities to do, like make yourself. I think one of the important things is like try to be kind to yourself. I think a lot of times, I think Asians especially, so much worse, right? Sometimes we tend to be quite harsh on ourselves, right? We always second guess ourselves, a lot of imposter syndromes and everything. So I think sometimes we have to remember to be kind to ourselves. Now, depressed patients, all the more will feel that way, right? So a lot of times when the person is depressed and they're negative, so people around them are quite important, right? You have what they call the toxic positivity, right? So in the sense that, no, come on, you can do it, life is good, no, don't worry about it, and all those things. So it doesn't really help. So I like to give this example whereby, when you want to tell a person not to think so much, like in Cantonese, they call it moi lang kam to la, tai hoi dik la, that kind of thing. Think more openly, just don't overthink. I never really encourage or like it when a family member tells a patient that. So I always give the analogy. So if I eat a very nice cheesecake and I show it to you, I say, hey, this cheesecake is really good. Okay, can you bake it for me tomorrow? Without giving you the recipe, right? So I just show you, let you taste it, and then you just eat it, and then you just eat it, and this is really nice, and then you bake it for me tomorrow. So telling a person to, oh, don't think so much, don't be so depressed, I know you're okay, you know. So it's similar to showing the person a cake, but not giving the recipe to them. So what the mental health professionals will do is we'll try to give you the recipe in the sense, okay, look, you have to do this. If this fails, let's try something else, and so on and so on and so forth. And even then, it's not easy. You know, so we try to do behavioral activation, let the person start to activate himself by trying to do something that he likes. For example, exercise will help. Exercise will release endorphins, which makes you happier. But the thing that we are looking for more is actually BDNF, brain-derived neurotrophic factor, which causes the branching of the neurons, which is usually decreased in depressed patients and all. So, but at the same time, we do not want to overexert the patient, right? Because if the patient can't do it, then feel very bad, right? So start to do small activities, choose the timing of the day, and then reach out for people to support. I feel like don't underestimate there are a lot of people out there, I think, willing to help you. So just start to reach out, and hopefully you get the appropriate kind of help.
All right, thanks, Dr. Ting. I think I'm going to take the questions now, one by one. So if you have more, please put them in now so that I don't miss out on your questions. Dr. Ting is here with us. So I think I'll take Gallen's question first. I think a lot of people also want to know. May I ask, what's the difference between seeing a psychiatrist versus a psychologist?
Okay, yeah, good question. I think I should have gone into that earlier on. So psychologists, psychiatrists are all medical doctors who, so we did 5 years of medical school, then we work as, so it's 5 years medical school, 4 years of practicing as a medical officer, house officer, then we do another 4 years of masters, then work 5 years as a consultant. So we have to be a medical doctor to study psychiatry. Right? So that's the difference. That's why we can prescribe medication. Psychologists will go into a degree in general psychology, then they will go into masters or PhD. So they are not medical doctors. So usually what they'll do is they'll do a lot of counseling sessions or talking therapy. So the more technical terms will be different types of therapy. We have psychodynamic psychotherapy, we have CBT, we have ACT, and so different types. So psychologists basically do counseling sessions. Psychiatrists can do counseling sessions. We also train in it, and we can prescribe medications. But because, for example, in Malaysia, we need about 4,000 or 5,000 psychiatrists. We only have 400 plus psychiatrists at this point in time, if I'm not wrong. So we are unable to also divide the time to do counseling and provide medication. So most of the time, we focus on medication, and if need be, we will refer the patient to psychologists. But some psychologists, some psychiatrists, they will do psychotherapy as well in the hospitals and all. So ideally, in the ideal world, where the air is clean, where the politicians are good and everything else, a patient should get psychotherapy and, if necessary, medication, right? Because psychotherapy is important for you to also know more about yourself, reflect on how you can change things, and someone can help you go through your mental health challenges. So then you can better yourself in a way. And then for those who are dysfunctional, then we need medication. So ideally, this should be the way. But then because of the shortage of time and expenses and all those things, then sometimes we have to choose, right? Yeah.
Yeah.
So that's how it is. So ideally, it should be both, right? That would be the best, yeah. But Malaysian insurance doesn't cover either one. So most of the time, just come see a psychiatrist, yeah.
I think we should definitely bring this up with the medical board, with the insurance board, that mental health should be covered.
We have been bringing it up for the past 10 plus years, so we are still trying to...
I should try to help you.
Yes, please. We welcome all the help we can get, yeah.
All right. I think that mental health is a disease that should be covered.
Yes.
Okay, that aside, I'll take one question from William. He says that he gets memory loss and think is weak. He cannot get up because his father is dead. So he asked for advice. I'm guessing he has depression.
Right. So it's a bit difficult to make a diagnosis based on, but So in cases like this, whereby let's say memory loss, I wouldn't call it so much of memory loss. I would say that maybe focus and concentration is affected. So most of the time, stress, depression, anxiety. I'm not sure whether you guys have experienced it, but I've experienced it when we are too stressed, right? When we're burning out and all, our focus concentration tends to deteriorate.
Yeah.
So that happens all the time. So let's say he mentioned that his father has passed away. So then if there's bereavement, that means there's grief, then we have to be careful about diagnosing depression, right? Because when the person has lost someone, so of course you will go through the symptoms which is similar to depression, but then so there's a very clear indication for it. So how do we decide whether we treat it or not, right? For example, if this is grief, do we treat it? If this is depression, do we treat it? Now, is this grief, transforming into depression? I think a lot of times for the psychiatrists, whether or not it's grief, when it comes to a point whereby there are symptoms that's very pervasive and affecting the person's life, and again, causing the dysfunction. So for us, the dysfunction is very, very important, right? Because we want you to normalize into the normal functionality. So if there's any dysfunction, then usually we like to err on we like to be careful, because then we will see if there's a lot of dysfunction in your daily activities and all. I would say sometimes we will give a short-term dosage of medication, yes, prescription of medication. Sometimes we will do that, yeah. But of course, therapy and everything that will be important, where you can find and afford. Because some smaller towns you can't find a therapist.
Thanks for answering that question, Dr. Ting. Now, the next question is from Madam Yu. Normally, once prescribed with antidepressant drugs, would one need to take it for life?
Okay, so yeah, thanks for asking this question, Madam Yu. Very, very important point. No, you don't, right? So the thing that I always tell people is that some people have to. We have to look at a few factors. So I like to compare to diabetes, because diabetes is just because, okay, for the sake of simplicity, of course, the endocrinologist will probably throw stones at me. But okay, let's say diabetes is due to low insulin, right? Very, very simple to just describe diabetes. Depression, again, very, very simply put, is because of decreased serotonin, right? But it's much more complex than that. I just want to tell you that. But to explain to lay people, let's say it's because of low serotonin. So first thing we want to do is we want to regulate that, right? You want to regulate insulin in diabetes. You want to regulate serotonin in depression. Okay. So once you regulate everything, now the medicine helped you up to a certain percentage, 60, 70%. The rest of it is up to you, right? So the change in lifestyle, pretty much like in diabetes, if you have diabetes, we give you the best medications and you change your lifestyle, then there's a very, very good chance that one day you can probably control it or go off it, right? Depending on how severe it is in the first place. Depression is the same thing. So a lot of times my patients, I will tell them you have to be on treatment for 6 months to 1 year. Then after that, let's see how it goes, for the first episodes. Then a lot of times the patients will ask me, okay, I completed medication. Can I go off it? So and they will ask me, if I go off medication, are there any supplements that I can take? I've read that, like the omega-3, this and that will be very useful. So I always tell them, so as Asians, we always like to look for shortcuts, right? We don't want to exercise, but we want to take supplements. We don't want to control food, but we want to take supplements, right? So pretty much like depression is, again, a medical condition, so there's no shortcut. You take medication, you regulate everything, but in the meantime, you exercise regularly, right? You follow the guidelines, 30 minutes, 5 times a week. You pray more, you meditate more, you increase your spiritual life. You have to do work-life balance. You have to eat healthy. If you do all these things, then there's a good chance that we may be able to get you off medication. But if you just take the medication and you just continue to work about 16 hours a day, you continue to, don't take holidays, you continue to just be negative, don't reach out to people for support, you don't exercise regularly, then of course it's more difficult. So the ball is actually in your court. But having said that, some people, just like diabetes, some people, even though they work very hard at controlling, it is still difficult to control. That's genetics. You can't do very much about that. You can only manage it. So for depression, it's the same thing.
I see. Thanks for that summary. It was actually very well explained. Wong asked, I think he says that he doesn't want to take medication because he doesn't want to be addicted to medication.
Sure. So again, good point. I'm very glad you said that. So our medications, our antidepressants, they are not addictive. So pretty much like the one that we are more concerned about and we control a bit more is actually the sleeping pills and the tranquilizers. So that one we don't want to take for long term because it can be a habit forming. But having said that, it is more likely that alcohol and tobacco is more addictive than my medication, and you can buy it from 7-Eleven. My medications, you have to look for a psychiatrist or a medical doctor, and it's really, really difficult to buy it. Yeah, so the addiction rate is actually not very high, and I think sometimes we are a bit, because for the patients when they need it, for example, if you can't sleep, right, you know it's so stressful, and the suffering is very great in the person. So we just want to give you temporarily. Antidepressants, on the other hand, I can guarantee you, you can Google it, you can Google it, you can search on social media. I mean, don't go for fake news. Just search the credible websites and that, you will find that antidepressants are not addictive, right? So if the question is like, can I not take medication? Yes, there's a chance that you don't have to take medication, but it depends on the severity. It depends on the genetic predisposition. For example, if my father has depression, mother has depression, brother has depression, uncle has depression, then it's very, very likely that my depression is very difficult to get out of it without medication, right? Because the genetics is too strong. But if let's say grandmother had depression long time ago, but cured after 1 year, then there's a chance that I can just exercise, pray more, see a therapist, talk it out, or try to improve my well-being. Then there's a chance that you don't have to be on medication. But a lot of times, we are not equipped to psychologically, like manage our stress. We always think that we are not stressed. I work 16 hours, I'm not stressed. COVID-19, 2 years lockdown, oh, I'm not stressed, I'm used to it already, I'm staying at home. But it's so different, right? It's so different from the time that we used to go out without mask. We go for holiday anytime we want to. Nowadays, you want to go for holiday, you always worry about the SOPs and stuff like that. So it's different. But people don't realize that, I think.
That's true. Thanks, Dr. Ting. I think we'll take one last question before we close the session. This again from William. He asked, "What is psycho-spiritual?" Is that
right? So, okay, thanks for the question, William. The psycho-spiritual, I think we realize in the improvement of psychological well-being, spirituality is an important part, right, in healing process, like anything else. So if you don't have a religion, if you're atheist, then we always talk about meditation, mindfulness, and yoga, things like that. If you are of a certain religion, then we will encourage you to pray more. I think by doing all those things, then you feel a sense of connection, right? I think sometimes we feel we all face existential crisis now and then, right? So if the person has a reassurance that God is there to take care of us, and do not have to worry too much about the future, so I guess that's reassuring. So some doctors do go into psycho-spiritual counseling, right? I think there are some doctors in Malaysia as well doing that. So yeah, it's one way of yeah.
Thanks, Dr. Ting, for answering that question. I think Wei Jing, who is a cancer survivor, she has one last question for us.
Sure,
she
no
asks, will depression cause insomnia and vomiting?
Okay, very good question. So I'm glad that you brought this up. So I talked about the neurotransmitter imbalance, right, in the brain, right? The part of the brain that controls emotions is what we call the limbic system. So the chemicals, the neurotransmitters, the serotonin, norepinephrine, etc. So that one goes a bit imbalanced. So you cause a lot of ruminations, etc., right? So I don't want to go into those things again. A bit short of time. Now we have to remember the gut, right? Our GI system, gastrointestinal system, our stomach and our intestines and everything like that. There's a whole bunch of nerves that is known as the second brain of the body, right? So because it's the whole complex system there, right? So when your neurotransmitters in the nerves go haywire, right? So it's a whole body thing, including the gut. So most of the time, depressed patients, anxious patients will complain of bloating, nausea. They've gone to see gastro will do scopes and everything like that, and they find that, just mild inflammation, nothing much to explain the severity of the symptoms that they exhibit, right? So they will have a lot of nausea, bloating, they have some discomfort, dyspepsia, indigestion, etc., etc. So a lot of times it's actually is correlated. Now, you talk about insomnia as well. Insomnia is one of the key symptoms in the 9 symptoms of depression. So
Depression.
obviously, yes. So obviously, it's related. So oddly, I mean not oddly for us, but oddly for the lay people, they were all quite surprised when they see that when I tell them, look, if you have done all the scopes and everything for your stomach and your GI symptoms are not better, that means your stomach symptoms are not better, let me try to help. So they're quite surprised that why should a psychiatrist offer to help the stomach symptoms? And a lot of times we can help actually, provided it's stress related. It's not a gastric ulcer or H. pylori or anything like that, right? So those things you have to get treatment for. But if you have done all those things and it's negative and you still have all the symptoms, then a lot of times our medications can probably help to a certain extent. It's a nerve
Okay.
regulator in a way, yeah.
Thanks, Dr. Ting. I think that was a very good insight for a lot of people out there. So, thanks for today's session, for joining us. He had to rush back from lunch to
Okay,
join us for today's session. So, thank
right.
you so much for sharing and for answering the questions and detailing
Pleasure.
more about depression with all of us. I think mental health, like I said, should be mainstream and should continue to make it more mainstream. So, um,
Yes.
please do your parts. Share today's live session with your friends and with your family so that they understand what depression is. And if they have it or don't have it, at least they will know. So I think the most important is awareness. So please help us do your parts to share. All right. Thank you so much for staying
Okay.
tuned. Next month, we will be back with more topics for Talking Life with Macy. So stay tuned to my Facebook page and my Instagram, and you'll find more information over there. Thank you. Have a great day. Have a great Easter Sunday. Take care,
Thanks,
everyone.
Vijay. Bye. See you
Bye. Thanks,
guys.
Dr.
Bye-bye.
Ting, for everything.
No problem.
Thank you.
Bye.